affordable for everybody in Lagos. And how do they intend to do that? With the Ilera Eco, Standard Jara, and other plans like that. These are plans that gives you healthcare all year round. If you're an individual above the age of 18, you get to pay 15,000 naira, and you get healthcare of different kinds. Think of it. In fact, the last time I had this conversation, I discovered that there are about over 724 registered healthcare providers under the Ilera Eco plan, which would include hospitals, includes drugstores and pharmacists and specialists here and there. 724 in Lagos State alone. And, they're also going about doing sensitizations. There are chat lines for you, for which you can communicate with Ilera Eco on. And today, because the Lagos State government is so concerned about your health and well-being and the availability of that to you, we're going to be focusing today on mandatory health insurance and corporate identification number. Yeah, that's your CIN. And to talk about this, we have the compliance officer, Lashma, Mrs. Moturayo Bada, with us in the studio. It's good to have you in the studio, Moturayo.
Yeah, thank you for having me.
And you look amazing, by the way.
Thank you.
Okay, so yes, if you want to see what Moturayo looks like on what conversation we're having in the studio, you can actually stream this live on YouTube right now at Super FM Lagos. This is happening live. So you have comments, please drop them there. You have questions, you can actually drop them there as well. And you can also call the numbers 0805 092 0927. You could also call 0802 502 7711 or 0705 890 4927, or you could send a WhatsApp message to 0705 6900927. As far as Lashma is concerned, you can actually have certain conversations with them. You can actually have some conversations with them via certain platforms that they would be giving us to talk on. Now, so let's get right to it and engage on compliance and mandatory health insurance and corporate identification numbers. Now, we've been talking about mandatory health insurance. I started with that, talking about the fact that the Lagos government has mandated it. Now, we've been talking about that for some time now. Please, can you tell us what informs this and what it actually means?
So what informs the mandatory health insurance is according to the executive order that was signed by the Lagos State Governor,
okay,
Mr. Babajide Olushola Sanwo-Olu. It states that the Lagos State Health Scheme seeks to promote universal health coverage, which means our governor wants a healthy Lagos. He wants all the residents in Lagos to be healthy, and it also means that all residents in Lagos State should subscribe to the social health insurance plan through Lagos State Health Management Agency. That's LASHMA.
Amazing. Now, this is so we're not just going to do the punishment. There is actually going to be ample time for you to get on this, go and register, and it's very affordable.
It is very affordable.
Okay, really very amazing now. So what are the provisions in the executive order that backs this mandatory health insurance? Because if we're talking about such things, I think we need to make it clear in order for people to be able to understand and see what they stand to gain and what might go wrong if they do not follow through.
Okay, so like I said earlier, the executive order was signed by the governor of Lagos State 16th of July 2024.
Okay.
And some of the highlights on the executive order are all residents, employers, workers in Lagos State to comply with the Lagos State Health Scheme law and the National Health Insurance Authority Act law, and which makes social health insurance compulsory. And it also means another highlight on the executive order is that all ministries, departments, agencies in Lagos State are to request for evidence of enrollment on the social health insurance plan before you can access their services. So before you can access their services, and if you are unable to provide this evidence of registration,
which is the CIN, I'm guessing.
No, that's social health plan.
Okay, social health plan, yeah.
Yes, you'll be denied services.
Okay, so now I seem to be mixing some things up, and maybe that's not something that the public might miss as well. So could you clarify between the social health services and the CIN and what disparity there might be between the two?
Okay, so the social health insurance is that's Ilera Eco. That's That it means residents of Lagos State will register for social health insurance plan. So that's what you use in hospitals.
Okay.
YCIN is corporate identification number,
Okay.
and it involves corporate organizations in Lagos State. So corporate organizations in Lagos State are to register for CIN, and by registering for CIN, you'll be able to subscribe your employees
Okay.
under the social health insurance plan.
Oh, this is really very nice. I'm guessing now if we can't get people from the streets, we can also get them from their places of work and the offices and see that they benefit. And this is really very amazing. Of course,
Yes.
it shows that there's been a lot of deep thought to put all of this together to see to it that it is truly accessible to every individual, because some people might be too busy to maybe take out time from work to come do this. And then if you can go at this from the office conversations, it's something that makes it a little easier to assess.
Yes,
And
yes, that's correct.
that's really very amazing to see. So what are the measures put in place to for this to be implemented, and will there be penalties for not enrolling on social health insurance?
Yeah, so part of the measures put in place is by engaging with different MDAs in
Yeah.
Lagos State,
Okay.
where there's a continuous engagement. The agency is collaborating with the different MDAs in Lagos State by implementing the executive order in their requirements
Okay.
before residents and workers in Lagos can access their services. And of course, there are penalties. But before these penalties, the agency is taking time to create public awareness sensitization. So if you're unable to subscribe to the social health insurance plan, you'd be denied services by this MDAs, the ministries, departments, and agencies. So that's part of the penalties.
Okay, that's beautiful. So then, but I just want to ask, because Lashma has come here a couple of times. We've talked about customer service. We've talked about quality control. We've talked about the efforts ongoing to really put out the word. I presently know that Lashma is in areas around Badagry and Ojo for 60 days, doing some sensitization, opening people's minds. That's starting in February, opening people's minds to giving them an opportunity to actually get on this. Now, we're talking about penalties, and we're talking about sensitization period, which I know the government has been doing for quite some time now. But around what time are we looking at that this might elapse, where we would then get to the point where we're saying, oh, if you've not done this as at this time, these penalties starts to kick in?
Okay, so the agency is currently working on we have an enforcement team,
Okay.
and we're looking at second quarter this year. So the enforcement team will start working on taking on these penalties.
Oh, wow.
Yes.
Okay, and these penalties, do they just apply to individuals who are not on the healthcare scheme, or it's also going to be maybe something that companies who have not enrolled their staff, or maybe do not have the CIN and the likes, are these penalties that some people might, maybe some of them might maybe get caught up in that contravention of the law?
Of course, it would affect corporate organizations too, because it's stated in the executive order that
Okay.
employers are to subscribe to the social health insurance plan.
Okay, so before we get to talk about the CIN, which is the corporate identification number and everything, we want to put some sensitization out there from Ilera, which is the LASHMA, the Lagos State Health Management Agency. And so far, so good. This morning, I've been talking to the compliance officer, LASHMA, Mrs. Motunrayo Bada, who is, of course, been gracious enough to tell us about why it is mandatory for you to have healthcare or register under a social health insurance scheme right here in Lagos, what it entails for individuals and what it also entails for the corporate organizations. Now, we'll go on a quick break. When we return from that break, we will be asking some more questions. But if you're listening right now, you're an organization, you want to ask questions, you want to see how you could probably enroll your staff in so you're not in contravention of the law, or you're an individual who is thinking, okay, I need to be a part of this because now it's something that is mandatory, you want to ask questions, the numbers are open for you to call. You can call 0805 092 0927. You could also call 0705 890 4927. Alternatively, you could call 0802 502 7711. We'll go on a quick break. When we come back, Ilera on Family Matters returns. Stay tuned. of course, we're working hand in hand. People know about this and ask the right questions. So if you have questions, we have with us here a compliance officer, the Lagos State Health Management Agency, in person of Mrs. Mutunrayo Bada. Of course, she's here answering questions, fielding questions, and she'll be here till 10:30. So if you want to ask a question right now, you have burning questions. I think right now is the time to put them out. So you could call the number 0805 092 0927. You could also send a WhatsApp message to 0705 6900 927. Alternatively, you could also call the number 0802 502 7711. We would love to hear from you on any of this conversation. Now, so far so good. I wanted to ask this question because, Lagos State, I've lived in Lagos for a long time. I practically grew up in Lagos, so not just live in Lagos. I grew up in Lagos. And for some time we didn't hear so much about the Lagos State Health Management Agency, but then as recently as the last, I think the first time I even heard about Lashma was 2021 or thereabout, when a friend of mine had enrolled on the program. And his wife had put to peg, and he told me all the amazing things that came as a benefit for him. So and seeing that much, I wanted to be on it when I moved back to Lagos. But then let's talk about, why the timeliness of this executive order now that says you must, as an individual, have healthcare have an HMO in Lagos, and also mandating that for corporate organizations. Why is it so pressing at this time?
Okay, so it's really pressing at this time because the government, the Lagos State governor, is trying to promote universal health coverage in Lagos State, and by this, the residents of Lagos State will be able to access quality healthcare services.
Okay.
Yeah, so that's the main reason.
Okay, so really very nice that we have this follow-up on that particular conversation. Now, so tell us about the CIN, the Corporate Identification Number. What does it entail, the amount, and how long does it take to process this application? Because I'm sure if corporate organizations are listening right now, they're thinking, okay, how fast does this happen? I have a staff strength of maybe 50 people or 60 or 70, or I have about 25 people. Will it take the same time as it would take us registering an entire company of 1,000 workers? Let's talk about that for a little bit.
Okay, talking about CIN, that's Corporate Identification Number. It involves corporate organizations in Lagos State. The corporate organization in Lagos State are to register their company through the regulations arm of Lagos State Health Management Agency. And by this registration, you'll be able to enroll your corporate organization will be able to enroll their employees under the social health insurance plan. And registration, it depends, the payment, the amount depends on the staff strength, like you said.
Okay.
So if you have a company of 1 to 10, you have to pay 5,000. With 1 to 10 staff, you have to pay 5,000 naira.
Okay.
And you have 11 to 50, you have to pay 10,000 naira.
Okay.
So from 51 to 200, you have to pay 25,000 naira.
Oh wow!
So from 51
to get your CIN.
Yes, to get your
Wow.
CIN. From
Wow.
51 to 1,000, you have to pay 50k. Then from 1,000 and above, that's 100,000.
Wow.
Yes.
So it's
affordable.
It's affordable, yeah. Because I heard you say 5,000 and I have to say, okay, that's that's like a couple of drinks somewhere.
Yeah.
And so it's good to see that this is something that people can easily afford. Now this message coming in from the Golden Voice says, good morning OSYB, good morning Ilera Co. So if my company is lower than 10 staff. Okay, so I'm guessing this person is trying to know if the numbers are lower than 10. How does the CIN work in that case? Maybe it's just a small, medium scale enterprise, a small business that has maybe about 10 or less than 10 people, and they actually want to enroll. Maybe someone that owns a small business that probably doesn't even have the proper registration yet. Is this something that they can be afforded?
Okay, so like I said earlier, there's a range, 1 to 10. You still get to pay the 5,000 naira, and you go through the Lashma regulation portal. You fill in the necessary details, your CAC, fill in all the necessary things that
What
you
if the
need.
person is not a registered company? Maybe the person just has a business, is doing this
You
on the
need
side
to be
because
registered.
you need to be a registered company.
Yes, you need to
Okay,
be a
so
registered company.
I guess that puts the clarification. So if you own if you're doing business in Lagos and you don't even have your proper registration, I think this is some sort of a red flag. You actually
Yes.
need to be registered so you could have your tax papers and everything
Yeah.
in order. Okay, but then okay, so for that kind of a company that visits, so let's assume this person who just sent this message actually also has maybe okay they do the CAC and everything, they have their complete registration, but then there's a small company between 1 and 10.
10,
You said
okay.
that's 5,000 naira.
Yes.
But then so what are the things they would need to fill and what is the procedure?
They'll just need to fill in the company's detail, use the company's email address, and when you're done registering, you make payment, and your CIN number will be sent to your email. It takes about 5 working days.
Oh, 5 working days.
Yes.
That's beautiful. So after the CIN is sent, what's the next thing that follows?
The next thing is to subscribe to the social health insurance plan. That's enroll your employees under the social health insurance plan.
So for individual employees, what does the rate work like? Is it like they have to pay a super premium, or there's a particular discount that comes with the fact that you're registering a couple of staff under the plan?
Yeah, that's it's still the same amount.
Okay.
Yes.
So per individual above 21, they'll be paying 15,000.
Yes.
So there's no discount like, oh, you people are 5,000 and we want to give you a discount or something.
Yeah, you get to call Lashma. Okay, we discuss that.
Okay, so
Yeah.
of course I'm thinking if we have a staff strength that is quite a number, and you need to register them. I know it's already very affordable,
Yes,
but then
it
you know
is.
people, us Nigerians and especially Lagosians, we always want to ask that. I feel with that. For instance, the name says Jara standard Jara plan. Of course, it's because Nigerians like extra.
Standard Jara plan because it has so many benefits. We've included so many benefits
Yeah.
that residents of Lagos State would enjoy under
Yeah.
this plan.
Okay, so it's really very amazing then. So let's talk about contact and communication and people actually reaching out to you, because yes, every other day we are on this show on Tuesdays like this, people always are maybe willing to visit the website because sometimes it seems too good to be true. That you get something so good for so little, getting all these benefits on the standard Jara plans and everything. But then people want to reach out, they want to call, they want to send a message, they want to be able to ask follow-up questions or make clarifications on some of the conversations we've had. What links would you prefer?
Okay, so we have a WhatsApp line.
Okay.
So you can reach us directly on WhatsApp. We also have a toll-free line, and other lines you can also send us email addresses, and you can visit our head office at the Good Shepherd House at Alausa.
Okay, so what are those numbers? Do you want to give them out so people
Yes,
could actually
yes, of
maybe
course.
reach out and send messages or call?
Okay, for the WhatsApp line, we have 070-4535-8275.
You could do that again.
So the WhatsApp line is 070-4535-8275. Then our toll-free line, we have 0800 Ask Lashma. That's 080-02-7552-7462. And our other line is 0700 Ilera. We have 070-04-5372-356. And you can also visit our divisional offices.
Okay.
That's Ikeja, Badagry, Lagos Division, Ekpe, Ikorodu. Yeah, we have offices there.
Amazing stuff. So social media, people are on social media, they just want to scroll through their phones. We live in an age where we want to put we just want to click and bait everything, like just click, tap, let's get the information. So if we have to reach you on social media, Instagram, the website and the others.
Yeah, Lagos State Health Management Agency is on Instagram, X, and yes, we're on Instagram,
X,
and
Facebook.
Facebook, yes, exactly.
Okay,
Facebook.
and the website?
Yes, www.lashmar.com.
Okay, thank you so much for making out time to be here today. Of course, in case you've been listening to this interview, we've been speaking to the compliance officer Lashma, Mrs. Motunrayo Bada, who is, of course, the compliance officer for Lashma, and she's given us quite some updates and conversations on all that we need to know on the Lagos the Lagos State Health Management Agency. The conversation around the governor making it an executive order, a mandatory thing that you have healthcare in Lagos. Now, in case you just caught the tail end of this conversation and you want to watch the whole thing, so you could catch the numbers, the conversations, the points that were made, the advice that was given, you can actually watch a repeat broadcast of this on our YouTube page at Super FM Lagos, and it's going to be there for a lifetime. So you could just go there anytime you like and click on the page at Super FM Lagos and search out the conversation on compliance that we've had today. But then I must say thank you so much for coming in today, Motunrayo.
Thank you for having me.
And big shout out to the gentleman who also was in the studio with us, doing the background work. But then thank you so much for listening to Ilera on Family Matters today. We'll be back again next week, Tuesday, with some insight into healthcare in Lagos. Remember, Ilera Lojewa Logun. Do not go anywhere. Stay tuned. We'll be right back.